Welcome to Positive Recovery MD. If you're listening, chances are you want to create happiness around you and thrive in your life. We're glad you're here and you've come to the right place. This podcast will inspire and motivate you to not merely survive your recovery journey, we'll give you the tools to build or strengthen your foundation to thrive and flourish in your life. Each week, we'll come together as a community to have authentic conversations around addiction, recovery, and what matters. Growth and progress, not perfection. All while developing positive habits for you to utilize in your life. To learn more, please visit positiverecoverymd.com to sign up to receive the daily positive interventions that we'll review, as well as gain access to exclusive Positive Recovery content available only to Positive Recovery MD listeners. All right, let's get started.
Hello, boys and girls, ladies and gentlemen. Welcome to another installment of Positive Recovery MD, the podcast with the most awesome guest today. Somebody I've known for a long time, but haven't seen for probably longer, if that's even possible. Ava Profota, who's a licensed clinical social worker, a certified sex addiction therapist, certified multiple addiction therapist, and supervisor for all three credentials. She's practiced and supervised clinical services in a residential substance use disorder center for 6 years, treated multi-addictions, co-occurring diagnoses, launched a clinical track for sex and love addiction and family of origin trauma. In addition to CSAT training, or the Certified Sex Addiction Therapist training with Patrick Carnes, the founder of the field, basically. She is trained with Pia Mellody in childhood development trauma resolution and studied the work of Bruce Perry, MD, who recently wrote a book with Oprah on childhood developmental trauma. Ava founded Interloop Counseling in 2010 to treat trauma and addictions in an outpatient setting. Ms. Profota was voted Counselor of the Year by the Houston Regional Texas Association of Addiction Professionals, and really probably Counselor of the Year every year by her husband, Dennis, who I love but haven't seen in a long time. Welcome, Ava.
Hi, how are you guys doing? It's great to be here on the podcast. I'm excited about what we're going to do today.
Awesome. I could tell. And for those of you that are just listening, she has a big smile ear to ear. And let's get going. So, Ava, why don't you tell us a little bit of your story?
So I got sober in 1989. And the reason I did it was completely an accident. I was working with Carol DeLongshaw, who is a long-time substance use disorder treatment professional in Houston. And as far as I know, she's still practicing. So she suggested that since I told her I was miserable and I was having trouble with relationships, she said, well, why don't you just try going to Al-Anon? So I went to Al-Anon a few times and I called her back and I said, Carol, I think I need something more. I still keep marrying alcoholics. And she said, well, why don't you try just going to an AA meeting and then you'll begin to see what alcoholics look like. So I went to an AA meeting and I caught it. I caught alcoholism. So I kept coming back. And a couple of years later, I realized, well, crap, I'm a love addict too. I have these issues with men. So a friend of mine invited me to an SLAA meeting. I went and I caught that too. I was so upset.
I hate how contagious those meetings are.
Oh, gosh darn it. Yes, they are very contagious. And so I decided at that meeting I was never going to go on a date. I was never going to talk to a man. I was certainly never going to have sex with another man. And I was going to swear it all off. And 2 days later, I picked up a really cute guy at an AA meeting. And Sunday morning, I woke up and went, oh my God, I said I wasn't going to do this. And I realized after that meeting how powerless I am over love addiction and relationship addiction and all those little things. So I've been sober in that program for 31 years and in AA for 32 years. It's unbelievable to me that I could be sober from either one of those for this long. The time went by like that.
That's so impressive, considering how difficult it is, not only to get sober from substances, but the sex and love addiction piece. To have that much time is really rare. Kudos to you.
Thank you.
It was just marrying alcoholics was your issue, huh? That's what started this journey?
Well, there's a little more to it than that. I was married and divorced 4 times when I got to AA and then to SLAA. And I couldn't stay faithful. I couldn't stay sober. And I've been married to the same guy for 28 years now. And I've never cheated on him, which is a freaking miracle for this girl.
Oh my God, that's crazy. So where were you born? What, brothers, sisters, mother, father?
Well, I was raised by two orphaned alcoholics. Both of them were orphaned under the age of 6. My father murdered his mother when he was 6 years old. And so he went from house to house after that in rural Louisiana. And then my mom, she still had a mother, but her mother wasn't all there because she'd had so many strokes. And her father died when she was 3. And she started smoking and drinking at 12.
Okay. Can I stop you for just a second? Your father murdered his mother when he was 6 years old?
My father's father murdered my father's mother.
Okay. I was for a second.
No problem.
I didn't realize we pinned murder on 6-year-olds. Okay. My bad.
My father's father.
Okay.
And it turned out that he was a pretty nasty guy. And in rural Louisiana, it was okay for you to shoot your wife if he thought that she was cheating on him, which she was not. Neither one of them really were older than about 13 or 14 emotionally. Right. And so they both had tremendous developmental trauma. And it's been a journey for me. So I started with my own journey of looking at that developmental trauma, except back then they didn't call it developmental trauma. They just called it family of origin stuff.
Right. Could you for our listeners and really anybody watching this, your insight would be awesome here. Can you sort of forecast a typical, not you necessarily, but, obviously the trauma in your life, being raised by two people themselves had trauma and then therefore, developmental issues, but arrested development from using alcohol as a coping skill. The sort of projection of your life is almost predictable.
Yes.
In a way, right? So sort of, you don't necessarily need to talk about you, but kind of what happens to kids raised in that type of environment.
It's fascinating how our brains develop. And then there's a lot of other neuroscientists talk about how the brain develops when you're an infant. And so the infant's self senses with the ears, eyes, nose, mouth, and feeling on their skin, everything in its immediate environment. So what is that? That is our parents, especially our mother in the beginning, and then siblings. So in my probably early 60s, I found out that my real mother, the person who really raised me, was my 7-year-old sister. So my mother drinking alcohol, 2 months later, she got pregnant, my little sister, and she had bad bronchitis. So she was drinking alcohol and sipping on codeine for the entire pregnancy. She didn't feel well. So I then was given to a 7-year-old to be cared for. And so with that, I realized, what I learned in my early environment was there's an intoxicated person that raised me, or that was my mother. Then I am given to a 7-year-old. So what do you think I learned about the world? Woo, not a whole lot. And there was a lot of chaos. My mother would throw things through the air, and sometimes they landed on other people. So it was really interesting. And when she was drunk, I saw that. When she was drunk, she would do the craziest things. She would black out, of course. So just putting little bits and pieces together, I can imagine what it was like when I was a child. And so no wonder at 35, I knew that I wasn't doing well. My brain wasn't clicking on all 4 cylinders, especially in the midbrain. And so the part of our brain that's working when we're born is the reptilian brain, or what we call the brainstem, and a little bit of the midbrain. And so we can eat, sleep, suckle. We can regulate our temperature if we are full term. I worked in a neonatal unit for many years as a respiratory therapist. And so I saw there were infants who were born really early. And back in the 70s, a lot of them didn't make it But at a certain term, I realized, okay, this kid can regulate its temperature. Many of these babies could not regulate their temperature. And so I put those things together and I'm like, God, we can't do a whole lot, even when we're full term. And so the midbrain and the brainstem are firing, but all these neurons and synapses are present in the brain, but they are just sitting there waiting to fire. So what we see, hear, smell, taste, or feel on our skin is what creates the firing in our cortex. So pre-verbal, which is up to just below 5 years old, everything that we see, hear, smell, taste, or feel on our skin is a memory that's stored in the midbrain or the brainstem. And these two things don't connect very well to our prefrontal cortex. And so we are operating on information that we saw, heard, felt, smelled for the rest of our life. And the rules of the immediate environment will get stuck, pretty much as like the foundation of our brain.
Right. Well, no wonder you married alcoholics, because there was an alcoholic around you.
Yeah, that was normal.
That makes sense, right? It's a normal thing.
We don't marry what we want or like. We marry what is familiar.
Yeah.
Ellen Fisher on that one.
No, that's so true. In fact, there was I read this not silly. It was actually a study, but it showed that like people marry others whose name is most like them, who are close in proximity to, all these things, and people whose name is like Dennis are more often more likely to be a dentist. There's like so many things that happen outside of our choice. Okay. So one thing you said made me curious when you said before age 5, it's non-verbal, but kids in development start talking, obviously babbling and talking. Did you mean learning is pre-verbal up till 5?
Yes.
After that, we learn with our words.
Right.
Okay, I got it.
More with cognition as opposed to how we feel, which is in the midbrain.
Okay, so cool. So that answers a lot of your family of origin stuff, if you will.
Yeah. And so the memories that we have before the age of 5 are not stored in the cortex.
No.
They're stored in the midbrain and in the brainstem.
Those memories are really like etched in stone almost, right? Like very tough.
Yes.
To rewire.
And when we have a feeling based on one of those memories, we don't know what's going on. We have no idea that we're reacting from a trauma that happened before we even could have pictures that were stored in our brain or stories. We don't have stories for those. So we don't have a lot of audio. And I'll have clients say, what I'm thinking of is a growling sound. Also, they can't identify it was a dog or it was a human being making really low frequency noises. Stephen Porges really has honed in on that. He has a protocol called Safe and Sound. And what it does is it retunes the eardrums of kids who had a lot of trauma in childhood to human frequency of and tone of voice, which is really amazing. It works well for kids with autism.
Wow. And so in adults that you work with, our stories obviously play a critical role in helping make sense of past trauma. And were you alluding to, I guess PTSD-like symptomatology, somebody who's had trauma? Could it be that an adult is, unaware of getting triggered of unknown trauma, something that happened?
Absolutely.
And so is confused about their feelings and lives their life for many years, right? Sort of repeating a dysfunctional type of reaction.
Yes, that's why the advent of somatic experiencing and EMDR have been extraordinarily helpful for working with vets.
Will you define both of those? Sorry.
Oh, sure.
Can you define both of those things?
Yes, yeah. So EMDR is eye movement desensitization reprocessing. And it has been one of the most effective, what we call brain-based trauma interventions. So for those memories that are stored in midbrain, and here you can't talk about them and help solve those. There has to be brain-based. And the 3 brain-based interventions are somatic experiencing, EMDR, and brain spotting. I learned about brain spotting probably in 2015. And I was really, really interested in brain spotting. And so this past year, I trained in brain spotting. It's amazing.
What is brain spotting? I got to tell you, on the surface, when I first heard about it, I was pretty skeptical because it doesn't sound very scientific to me.
Me too. I was like, oh, that's voodoo. And you know what got me interested in it and made me want to do it?
LSD? No, sorry.
No, that was back in the 70s. So I was working with a client one day, and he said to me, you know, Ava, I went over to the ranch in Tennessee and they do brain spotting there. And I said, really? What did you think about it? And he said, oh my God, Ava, it was amazing. I really felt something. And I said, well, tell me what you mean about that. And he said, well, they had me look at a spot and then they moved this thing around, and I found that if it was here instead of anywhere else on the screen or in my field of vision, I felt this trauma we were talking about, like instead of this big, I felt it that big. And I'm like, really? And so where you look, and this came out of EMDR, by the way, David Grand is the inventor or discoverer, I should say, of brain spotting. And so it's really interesting. I can take a client we use subjective units of discomfort, SUDS, SUD, as our scale. And so we use a scale of 0 to 10. And so I'll ask them, okay, so here's the spot. How big is this issue for you right now? And they'll go, oh my God, it's big, maybe an 8 or a 9. And I'll say, okay, well, think about it a little bit more. And then I'll check with them again. What's your SUDS now? Oh my God, it said over 10. I said, well, there's nothing over 10, but that's
11.
And so by the time we get done, I can get them down to a 3, a 2, sometimes a 1 or a 0. And I'm thinking, oh my God, I'm going to figure this out, and I'm going to become a trainer for brain spotting because it is so effective.
That is great. Okay. And somatic processing, or what was
somatic experiencing? So I don't know a whole lot about somatic experiencing, but what I do know is Peter Levine has, and you may have seen his slide on being out of, so there's a narrow window, or it's a pretty wide window of, discomfort that we can tolerate pretty well. But when we've had trauma, we can get stuck in the extremely high zone outside of that narrow window, or we can get stuck in the freeze or numb or just feeling disconnected from our body zone. And so those two zones are where trauma lies, in way above plus or minus 2 standard deviations or way below. And so somatic experiencing helps to deal with both, but primarily somatic experiencing deals with the zone where people are just frozen. And I've studied a lot in Vander Kolk's book called The Body Keeps the Score, another excellent explanation of why we feel the way we do based on what happened to us as children. And so much of it is in that under the age of 5 pre-verbal zone. So we can't touch it with talk therapy. I have a slide. Would you like to see it on effectiveness? Sure. All right. This is a follow-up study with the Sandy Hook tragedy survivors, teachers and students. So this is the very effective zone. This is the effective zone. This is the somewhat effective, and this is not at all helpful. So at the top of the chart is brain spotting. Somatic experiencing is here. So this is almost 60% very effective. This is 40% very effective. And down here is EMDR, about 31%. And then traditional talk therapy.
Yeah, it's more than double for traditional talk therapy. For our listeners, brain spotting is more than double the effectiveness, and that's pretty good. So let me ask this question, Ava: if I were to do brain spotting in conjunction with talk therapy, would that create a space of more of an 85% efficacy because of the numbers, or what does that look like?
Yes, in fact, my trainer does 100% brain spotting. She lives out in California. She has the Pacific Trauma Center, and she probably has trained thousands and thousands and thousands of therapists. So that's all she does every day, all day long. No talk therapy. And the intake, I just did intake with her. She does an incredible intake. And every issue that you have, like negative cognitions, how you're feeling, what's your SUDS level for anxiety, depression, pain, performance, negative thoughts about yourself. And so by the time she gets done with them, in sometimes 8 to 12 sessions, all of those numbers are less than 2 or 3. And most of them start at between 7 and 10. That was impressive to me.
And in a relatively short span of time, too, like you're talking 12 weeks of therapy that this is taking place in. How many times a week are you doing brain spotting? If once a week. Okay.
Because the brain spotting, when you actually do it, continues to change things that are going on in the brain for several days and actually months afterwards. And that's, it's almost like a miracle pill. It's like the pill that helps to resolve trauma. She said she's done between 2,000 and 3,000 clients, and she hasn't been able to get one client down to a 2. One.
That's amazing. I don't even know statistically what that number is, but it's so small, I can't figure it out.
It's less than 0.001%.
It's like if you treated 1,000 people, one person's foot wouldn't get better. That's sort of like what it
Exactly.
That's how small. So Ava, one thing that I run into is the challenge of having created something with the word positive in it. Because positive recovery is not only about building. It also includes trauma resolution and shame resilience. And, there's more business as usual, which includes cognitive behavioral therapy, a lot of experiential stuff, nothing to the order of somatic experiencing or brain spotting. But, between dealing with the past and unclogging the pipes, if you will, right?
Exactly.
And building, the most important thing and the thing that should come first is unclogging the pipes or dealing with past trauma. Because
stuff we can't see or no.
We've given you positive intervention today, and interesting enough, we'll get to that in a bit, but you said, this is what I do. This is how I live. People that might approach trauma therapy might have, I think, the same bias as what I fear happens when people hear positive recovery, because, building or doing positive recovery isn't only about feeling great, and seeing somebody like you is not only about miring oneself in like what's wrong and the trauma, because that's really no way to live. So so people that might be afraid to approach trauma therapy, like what do you have to say to them? Because I'm sure a lot of people are approaching it with or are afraid to approach it because they don't want to be mired down in what's wrong all the time, or they fear you just get them crying and that's all there is to it.
I'm so glad you asked that question. First, I want to tell you, in 1985, I went through a rough divorce. And when I came back to Texas from that, where I was living, this thought popped into my head. And it was, I want to bring positive energy into the world. I remember that thought. And I even wrote down a few things about it. And then I totally forgot about it until not too long ago. And that's pretty much what my mission in life has been since then. Although I was drunk for the next 5 or so years, that didn't help. When I saw what was the positive intervention for today, I'm like, oh my God, that's exactly how I live my life. And so, when somebody comes in with a lot of trauma, I try to help them in the moment go from a 10 to at least a 4 or 5 with just a tiny, tiny bit of brain spotting. And so they're always amazed, wow, how could I feel this much better in 20 minutes? And I'll say, this isn't the end. This is the beginning of you starting to feel a lot better every day, all day long. And it's going to look like this. That's how recovery looks. You start like down in the gutter, way below the line. And then you get here and you think, oh my God, this is the most wonderful thing in the whole world. But then you're going to keep going. And that's what positive recovery and thinking does. I had a woman 3 days ago who came in with her brain was she was in that way up arousal. And so we got her down to about a 7 from a 10, but she could not stop thinking negative thoughts. And that was her entire mind was filled with negative thoughts. And so that's what happens when people are in trauma. They begin to see the world in themselves in a very negative way. They have negative affect. They have negative thoughts. They feel very anxious on one end and depressed when they calm down from the anxiety. And so it's just a big old roller coaster in that limbic brain. And so helping them to think about something positive. Meditation, for example. I could not do meditation when I first got sober. So what I decided to do was just try. And I'm thinking I have to do an hour of meditation to feel better. So I thought, well, I just need to do one little step at a time. So I decided to make my mind blank and just put a positive thought in there, like ocean surf, ocean waves, ocean. And so every time I had a negative thought, I would bring that, because that's a very pleasant memory for me. My dad and I went to the beach a lot when I was a little kid. And so it's a very pleasant experience. He wasn't totally drunk when we first got there. So I used that for a long time, and I just asked people, what is your positive thought? And that's called resourcing in brain spotting. So there can be a spot in your field of vision that corresponds to when you went to your grandmother's house or when you went to the beach as a little kid. We do something called advanced resourcing. So instead of finding the spot where it feels horrible, we find a spot that corresponds to that wonderful feeling at Aunt Katie's house, or that wonderful adventure that we had at Uncle Joe's house, or being at the beach, little Ava being at the beach with her daddy. And then we find a place in the body. Where do you feel that the most? That positive, and we call it GNC, like the vitamin store, grounded, neutral, or calm. It's not a happy place, but it's at least, and then a place in the body. Where do you feel that most in your body? So the eye spot, the thought, place in their body, and then we process their trauma from that triple resourced place. And also, one eye can be more calming than the other, closed eye or open eye. So we do like quadruple resourcing. And then there's also what we call vergence, near and far away, right behind my nose and the back of my wall. I just imagine a place that's far away. Maybe Australia. It could be Australia. I like Australia. Never been there.
Never been.
And so vergence is near, 5 seconds, 1,001, 1,002, and then far. For the people who have that kind of anxiety, like my client this week, that was the only thing that got her from a 10 to a 7 in the moment. But brain spotting is so positive that you build on. Each session becomes more positive. So it helps you with this. In between, you may have a sag, but the next time, instead of making it only to here enjoy, you could make it to here, and the next time maybe there. That positive feeling for me is definitely a miracle.
Well, it sure seems like you're aiding and helping and working miracles with the patients who you treat. I wonder, like from a visual perspective, do you actually map that out for them so that they can see where they're at? Like here, I was at a 10, now I'm at a 7. And so they have a visual to reflect back on and carry out over time?
Yes. And so the intake class that I did a short time ago, when we do the intake, we ask them about every trauma. How big is this, 0 to 10? And we write every single one of those down. We also add in, what difficult experiences did you have as in adulthood? We write those down and put the SUDs on everything that we do. I had like 45 specific things that we're working on the client that I was working with. And so we do a check every 4 to 6 or 8 weeks, depending upon what I notice in the client, because I notice like how their face looks, any twitches, anything that gives me a sign that, there's a place whatever they're looking at, whether their eyes are closed or open, they have a brain spot there that can be utilized to help them heal all traumas. And when you work on one, you're working on all traumas. And so every 4 to 6 weeks, we check on that and we look at every single one of those 45 to 50 ideas or issues or thoughts. I've shown them, okay, you were at a 10 here. Now you're at, a 7 or a 6 most of the time. And then over here, now these are all 2s. 1s or 2s, except for this one, this one, this one. The zeros come off the list. And so they can see the list shrinking and the numbers going down. It's the most effective way, I think, to help a client see this is working or it's not. With Lisa's client that she's still working with, she has done all sorts of additional interventions, medication, neurofeedback, anything else that could help her. Meditation, if she's taking chemicals, let's figure out how you get sober from these chemicals. So it's an excellent way to show instantly for the client that they're making progress.
A question that I get asked a lot, and I just want to share this with our listeners, is how soon is too soon to start working on trauma if I'm just starting in recovery, right? Like, is it too soon to start working on all my trauma if I'm in recovery for 2 weeks?
For any other intervention, I would say yes, except for, giving them positive affirmations and helping them see how you can change your thinking from very negative to very positive. But they can start with a triple resource after detox.
Got it. Thanks. I know sometimes it's controversial. Do we start digging into the trauma too soon? And does that open them up too much? And then they don't know how to manage without the substance?
So with talk therapy, this was really interesting that I learned in this intake. Talk therapy makes trauma worse.
Okay, that's what I was going to say. So in it's contextual, right?
Right.
So if you're doing talk therapy, yes, I'd say there's definitely a time that you don't want to open somebody up or explore trauma.
Exactly.
Yes. So not every facility has resources like an Ava that I think would be most optimal. So yeah, you definitely don't want to, if you're a therapist, you don't want to say, well, okay, you can always do it, because it definitely depends on the modality that you
Absolutely.
use.
Also, it can help with cravings. Brain spotting helps with performance. A lot of Olympic athletes are using brain spotting. It helps with pain, physical pain.
Really?
It helps with decreasing cravings.
Wow.
So you don't just use it for trauma. You use it for lots of other things.
So for performance, wow. Okay. Let's switch gears a little bit, have some fun.
Yes.
So answer, you're very pensive, and try to just, whatever pops in your head is going to be the right answer. Who do you like better, me or Julie? No, I'm kidding. I'm joking.
I know you better, so it would have to be you.
Okay. I win this round, Julie. Woo! No, I'm just kidding. Yeah,
Actually, we worked together at a treatment center. I bet you don't remember that either.
At the park?
Yes.
Yeah.
I was at La Concha when you were there.
That's right. So, okay, just kidding. There's a lot of coyote energy when I'm around you, so that's why I like that fun. What is your favorite sound?
Ocean waves.
And what is your least favorite sound?
Scratching on a chalkboard. Nails on a chalkboard.
And your favorite word?
Ocean.
And your least favorite word? Chalkboard. I'm kidding. we got to stay with the themes here. No, least favorite word.
My least favorite word? Cancer, maybe?
And in an alternative universe, what vocation would you love to have a stab at?
Being a surgeon.
Wow. Okay. Yeah, what you do is surgical,
It is.
Yes, totally.
It's with an imaginary knife.
You're a brain surgeon or a human surgeon. Anyway, who cares? I diverge, Julie. I'm sorry. What vocation, if you were forced to do you think you would just loathe every day?
Being a preacher.
Amen.
Speaking of preachers, when you die and imagine that there is a God and you're at the pearly gates in the gated community of heaven, which needs gates, what would you like to hear come out of God's mouth to you?
That's interesting. I actually have a completely different belief. Well, basically, it's not the word, but the experience of joy.
Awesome.
So what do you call that? Euphoria.
Okay. Awesome. So Julie, you want to lead us in? Hello?
I absolutely do. So at Positive Recovery Centers, we often use positive daily interventions, and we sent one to Ava, and Dr. Powers kind of shared a little bit about this, and as did Ava when she said, like, this is basically how I live my life. So I want to share it with our listeners. I'll start with a quote, and that's by Rachel Naomi Remen. The most basic and powerful way to connect to another person is to listen. Just listen. Perhaps the most important thing we ever give each other is our attention. A loving silence often has far more power to heal and to connect than the most well-intentioned words. And that does seem like a perfect quote to kind of introduce and have Ava be part of us with. I've referred a lot of folks to Ava over the years, and the feedback that I get after their experience with her speaks volumes, and also speaks that her listening skills are very honed. It is said that people have 2 ears and 1 mouth, so they can listen twice as much as they talk. Unfortunately, people often listen 1/10 as much as they speak, as if each person had 20 mouths and 2 ears. By talking more than listening, people fail to practice mindful awareness, and they risk losing out on the chance to bond with others. Being loved closely parallels being heard. Being heard means you are valued. When you give someone else the gift of value, you give that person the universe. Listening is one of the most difficult skills to learn, and many people have not fully developed this ability. So our positive intervention was to listen in order to give others a gift beyond words. Listened with your mind, heart, and soul all day, and then using the strength of curiosity more today, pausing before speaking and asking clarifying questions whenever possible to increase the speaker's experience of feeling heard and valued. At the day's end, journal for 10 minutes. In doing so, practice listening to yourself. So Ava, tell me about your experience with this positive intervention.
My mentors, Ken Wapnick, said that we get to know a person not by the words that they say, but the space between the words that they say. The music is not the notes. It's the absence between the musical notes that is the music. It's our experience of music, our experience of a person that really tells us who they are.
Nicely said. So were you able to, since you live this way every day, and you just kind of gave us that kind of definition of what that looks like and what one of your mentors shared with you, how do you use this on a day-to-day basis?
So on a daily basis, in order to be able to experience that energy, I have to be very rested. I am not worth a darn if I don't get enough sleep, if I haven't exercised in a week. And so doing really good self-care. When I don't do that, what happens is I've got all this garbage that's between me and that sense of the space between the notes when I'm listening or in the presence of others. I just learned a lot about both of you today. I was primarily tuned in to Jason since I know him better, but I experienced some amazing energy from Jason today that I never knew about him. And so it's so interesting to talk to people, and probably within the first 10 to 15 minutes, I can tell how much trauma a person has. I can tell where they derive their sense of safety and security from, how they love, and the walls that they have between them and being able to love other people and receive love from other people. People who have a lot of trauma have so much big walls between them and other people. And I'll give you an example. My mother had a wall that is called a wall of words. She never stopped talking. Every conversation with her was one way, from her to you. I mean, there was nothing about her. I mean, when she died, she had no idea who I was. And it was her trauma.
Thank you, Ava, for sharing that piece with us. I think it gives us a lot to think about on how we show up with other people and what we do in that space. Just sharing from a personal level, Depends on who I'm talking to. Sometimes I can be chatty Cathy. Dr. Power seems to be on the receiving end of that for me sometimes, where I just am and just chatty. But other times I'm with people and they'll ask me what's wrong. And I'll say, nothing. I'm listening to you. I'm hearing you, and I'm not saying very much, but it's because I'm really taking in everything that they're saying, and I'm holding space for the conversation to come to me, not from me. So just interesting how it can be when you are with different people, right?
Yeah, I think it's my obligation to do really good self-care so I can be of service.
Awesome. Well, it has been an amazing afternoon with you today, Ava. Thank you so much. For our listeners, if they wanted to get in touch with you or seek some guidance or counseling, best place to do that is at Inner Loop Counseling.
Yes.
Fantastic. And when we air the podcast, we'll share all that information. And again, I thank you so much for being with us this afternoon. I know I am better for knowing you.
What a gift you are. You have been exuding positive energy. Maybe not exactly since 1985, but certainly since you got sober. And those of you listening, she really is an amazingly effective therapist. Remember, this is not a dress rehearsal. So please take care of yourself and take care of others. Until next time.
Thank you for listening to this episode of Positive Recovery MD. Don't forget to visit positiverecoverymd.com to sign up to get your daily positive intervention sent straight to your inbox. Be sure to subscribe to Positive Recovery MD on Apple Podcasts or wherever you listen to your podcasts to receive an automatic download when a new episode drops. And as always, if you or someone you know needs help, visit positiverecovery.com or call 877-4-SOBRIETY, which is 877-476-2743. We are here to help.